Hello everyone, this is Dr. Kanaan, and today we will talk about the recent closure of Inbrace and how it will affect us as orthodontists and the patient and what options we have for us. So when that email came to us, I think on Tuesday, April 22nd, and they announced the discontinuation of the business, immediately in my mind that, oh my gosh, how can I continue to finish this treatment? They paid extra to get lingual braces, to get this, the luxury, or what Inbrace was advertising as a Tesla of braces, and then all of a sudden this Tesla of braces is shutting down. How can we help this patient? I have like a moral obligation to give the patient what they paid for. How can we continue this? So two things. Like I gave it almost a week of thought. I just came back from the AAO, and I met some doctors who were talking about the situation. So when you sign up with Inbrace and you finish the class, you must have received a box like this, okay? And inside the box, you have the Inbrace starter kit, okay? And inside this box, this is very valuable because now they're not gonna ship anything. So we need these brackets, and Inbrace system is based on only 4 bracket system. You have upper anterior bracket, large posterior bracket, small posterior bracket, and lower anterior bracket, okay? So if the patient happen to have a broken bracket, we have some backup to continue these cases. In my situation, I don't know about you, but most of the doctors who I have talked to, they started from last year to this year 5 to 10 cases. So this pack has 10 brackets, so you should be okay. So when you start when you start your subscription, you should have received this one. Another good news is Inbrace, for each patient, they always ship us the bracket with the complete wire system. But the problem with the wires, if you have noticed, is that these wires sometimes they break. Sometimes the wire will fail to deliver the proper torque or rotation that is needed for that tooth, okay? And today I will share some tricks. So number one, we always know that these indirect bonding trays, never throw them away. So if the patient happened to break a bracket, get a number 15 surgical blade, cut the tooth individually, and then you can place the bracket back. If the bracket is deteriorated or the patient lost it, use your backup. Now, as far as the wires, Inbrace lately start to send us 2 sets of number 1, and then you have the final wire. So I was counting to continue these cases based on the wires that they send me, and we have a problem if the wire break. If I have a wire that has already broken, what are my options? Because they have these loops, and most of the time the wires will break from the loop area. So I try to weld it. If you weld it with the torch, you're gonna damage the wire. These are heat activated wires. I tried also with the arc or the laser welder. We got some success, but the welding was not strong enough to stretch it. So under compression it was okay, but to stretch it, it was not strong enough. What I noticed that if you get a crimpable stop and you try to crimp both wires very tight, it might hold. So you can crimp it and add some flowable composite over it. The patient might feel a little bit weird, but I think it will work if the patient is careful. Another option, immediately after the closure, of course, Invisalign jumped into this opportunity, and Invisalign, they have the bracket buyback program where they will give you a discount for cases that you already have started with braces, and lingual braces is one of them. So you can switch the patient to Invisalign. What I think the best scenario for our patient, and to be fair to them, is to continue their treatment with the current wires, the one that we have received so far from Inbrace, as long as we have the wires intact and okay. If you have a broken bracket in an area and you need extra force, maybe we can put like 2 or 3 clear brackets from the facial, and then add make like a hybrid system. And then once we reach the final stages of fine-tuning, we can implement some tricks that we have learned. So for if you want to put an extra rotation, sometimes what we can do, we can put a T-tie or like a little composite into that bracket, and you can get a little bit of a rotation. Or what I figured out, what's a great option is Invisalign to go. So don't finish it perfect, then change the patients to Invisalign to go, and this final fine movement, you can fix it with Invisalign, like 3 or 4 trays, and it won't cost you that much. And this by this way you are happy, and you will make your patient happy. I think if you have any tips or any trick, you can leave your comments below. I think also we as orthodontists, if I have an extra bracket and the new patient needed, or somebody has only started, they already have sign up for the program, and we have these brackets, maybe we need to sell them or just give these brackets to the orthodontist who needs them. I also believe deeply that Inbrace should not have done this abruptly. They should have given the orthodontist some time. But this is how the businesses are running here. You go to these big companies Thursday night, and then Friday morning they shut down. That's how the system is. So we live and we are part of that system, and we cannot change it. But from an ethical standpoint and a moral standpoint, I think Inbrace should have given us an advance notice that we are planning to shut down. If you need to order supplies, or if you need to order extra wires, or whatever you need for your patients, give us some time, and we will go from there. But we are stuck now, and we have to use our creativity to finish and continue these cases. Again, if you have any suggestions or any input, put your suggestion in the comments below. And I also put a little article on our website, ismyspecialist.com. Thank you so much, and I hope this was helpful for you.